So, did you know that most of the women are either underdiagnosed, misdiagnosed, or overdiagnosed with having PCOD? A woman having normal regular periods could also be having PCOD. A woman who has a normal ultrasound could also be having PCOD. A woman who is not obese could still be having PCOD. So we all know how common is PCOD, but it is very, very important to diagnose PCOD correctly. It is important to make the right diagnosis of PCOD because the future implications of PCOD are not just cosmetic like acne or hair fall or maybe increased hair growth, but there could be serious medical implications like diabetes, hypertension, heart disease. At the same time, it is important not to make a wrong diagnosis of PCOD because this could involve unnecessary tests, unnecessary treatments, and a huge psychological impact to a woman. So hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So September is PCOS Awareness Month and it is marked globally as the Awareness Month for the PCOS. So this month we will be getting you a lot of interesting and medically backed information which will empower you to take care of your PCOS. So worldwide, according to all latest medical guidelines, PCOD is diagnosed by following Rotterdam criteria. This basically involves 3 points. Number 1 is the ultrasound diagnosis. Second is menstrual irregularities. And third is presence of clinical or biochemical evidence of androgen excess in the body. So for the ultrasound diagnosis, there should be presence of more than 12 follicles ranging from 2 to 9 millimeter in either of the ovaries, or the volume of either of the ovaries should be more than 10 ml. So what are follicles? Follicles are developing or the budding eggs in the ovary. So the typical ultrasound appearance of the polycystic ovary is called as string of pearl appearance in the ovary. Second is menstrual irregularities, which means if a woman is having irregular, delayed or scanty periods, it's a sign of irregular or absent ovulation, which once again is diagnostic of polycystic ovarian disease. Third is presence of clinical or biochemical evidence of androgen excess. So what are androgens? Androgens are male hormones. So if you have a clinical sign, which means if you could be having acne, scalp hair fall, or the presence of increased hair growth in the body, once again it's a sign of androgen excess in the body. So typically the increased hair growth in the body is called hirsutism, and it is measured by measuring a score which is known as FG score or Farriman-Galloway score. So in this score, we actually measure the hair growth in the 9 body parts and we assign them a score ranging from 0 to 4. Now these body parts are upper lip, chin, chest, upper abdomen, lower abdomen, arms, back, buttocks and thighs. So a score of more than 8 is called hirsutism, and once again it could be diagnostic of PCOD. Then in case your blood tests show the high level of male hormones, that is also taken a diagnostic point for PCOD. So out of these 3 points, 2 have to be present to make a diagnosis of PCOD. Now this means that if your ultrasound showed some cyst, it doesn't mean that you have PCOD. In case you just have irregular periods, no other problems, and your ultrasound is normal, it doesn't mean that you have PCOD. In case you just have acne and hair fall, it doesn't mean that you have PCOD. There could be some other reason for this. At the same time, it is also very important to exclude other causes of above symptoms. So, it is important to exclude thyroid disorders, hyperprolactinemia, congenital adrenal hyperplasia, Cushing's disease, androgen secreting tumors, and hypogonadotrophic hypogonadism. Then a small word about PCOS in adolescence. Many symptoms of puberty actually mimic the symptoms of PCOD. I get a lot of mothers getting their 11-year-old or 12-year-old girl saying that she has PCOD because the ultrasound diagnosed the PCOD. So do not worry. Just monitor her cycles. In case the irregular period persists for about 2 years with features of androgen excess in the body, then yes, it is important to investigate. Then how to diagnose PCOS in perimenopause or in menopausal women? It's very interesting to note that actually PCOS women tend to have their menopause almost 2 years later than women who do not have PCOS. Also very important, PCOS does not go away after menopause. Remember, PCOS is not just irregular periods. In fact, many symptoms of the menopause actually could be like that of PCOS. So how does the doctor arrives at the diagnosis of PCOD? Obviously, in the beginning, the doctor takes a detailed history about your periods, about any acne, hair fall, or the increased hair growth in the body. The doctor also likes to take certain measurements like your body weight, BMI, your blood pressure. There are certain other measurements also which help us in the diagnosis of insulin resistance. So it is the waist circumference, the waist hip ratio, the waist height ratio. We will soon have a video coming on these measurements in detail on Maitri soon. So stay tuned in for that. Then coming to the blood test and the ultrasound. So we spoke about the ultrasound a while back. About the blood test, remember, there is no single test to diagnose PCOD. The test could be done to see the level of androgens in your body. In case you are struggling with getting pregnant, the doctor might order the fertility test. The doctor might also get tests for the insulin resistance. The doctor might want to rule out other diseases like thyroid, prolactin, or the adrenal cause. We also want to check for certain deficiencies like vitamin D, iron levels, vitamin B, or folic acid. Androgen test. Testosterone. This is often the initial test to determine whether you are producing excess androgens. This level is usually elevated with PCOS. It could be total or free testosterone. Then, sex hormone binding globulin. This may be reduced in PCOS. It's a protein which binds the estrogen and the androgens. So, in PCOS, this level is reduced, leading to increased level of androgens and estrogens. Then DHEAS, it may be elevated. Androstenedione, it's an androgen and that also may be elevated. Fertility test. Follicle stimulating hormone, this may be normal or low with PCOS. Luteinizing hormone, this is usually elevated in PCOS. LH and FSH ratio, it's usually elevated more than 2 in PCOS. Estrogen, it may be normal or elevated. AMH, anti-mullerian hormone, this is usually increased with PCOS. Serum progesterone, to check if you are ovulating. Tests to rule out other conditions with similar signs and symptoms. TSH, thyroid stimulating hormone, to rule out a thyroid disorder. Cortisol, to rule out Cushing syndrome. prolactin to check for elevated prolactin levels in the body. 17-hydroxyprogesterone to rule out congenital adrenal hyperplasia. HCG to rule out pregnancy. Tests for insulin resistance. Fasting sugar, fasting insulin, 2 hours oral glucose tolerance test, HbA1c, and HOMA-IR, which is homeostatic model assessment for insulin resistance. Then tests to rule out deficiencies like CBC, serum iron levels, vitamin D levels, vitamin B12 levels, and levels of zinc. So it may seem as if your doctor is advising you a lot of tests, but all these tests actually help the doctor to arrive at the correct diagnosis and plan the right treatment protocol for you. And once again, it is very important to make the right diagnosis of PCOD so that a proper management plan can be made for you. So today, if you found this information useful, please do not forget to like, share, and subscribe to Maitri. Do not forget to follow us on Instagram, LinkedIn, and Twitter. And we will see you soon.